Allegiance. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We have approval of minutes, and we have three of them this evening, January 28th, February 11th, and February 25th. We'll take them individually.
Mr. Chairman, I'll make a motion to approve the minutes from January 28th, 2020.
Could I just, one question on them?
Yeah, sure.
I think in the section where it says FY 2021, I just want to ask a question. Dr. Weiner, I think that you made it a statement that the budget does not affect elected officials about getting a raise, but in here, I think it says only the appointed officials. Is that just staff? Should that be staff only?
We're talking about which one, the 20?
It's the first minutes, and it's under, for year 2021 Board of Health budget. And it was just your statement on the bottom of the paragraph. Is that, I think it should be staff, because we don't, appointed that I think of, right?
Elected officials are not getting a raise, from what I understand.
And it says
Right,
only
it
the
says
appointed.
only appointed officials. Should that say only staff? I'm just asking if that's, or is that?
Which date are you talking about?
It's the 28th of
The
January,
28th.
page 2.
The
down
first
Page
the
one.
bottom.
2, down at the
Yeah,
bottom.
and it's under the,
Maybe staff, maybe, staff.
I think you said staff. But that's why I just think just- Is that right?
Oh, instead of only the appointed
Appointed
officials.
officials, so should it say only staff?
That is probably what you,
I think.
I don't recall the
I
conversation.
think
I
said
did
staff.
say
Yeah, I
what
do.
he
I think
said.
it's just a.
Yeah.
Okay,
So,
so
Mr. Chairman,
only staff.
So,
Yeah.
Mr. Chairman, I'll make a motion to approve those minutes of January 28th with the modification.
Sure. And I'll second.
I have a motion, well, let me say, make sure everyone is, you were here, thank you.
I was, that's why, and I
have a
read those
motion.
clear
Any
because
other
I was here that
discussion?
day.
If
I knew
not,
I
all
could
in
vote.
favor?
Aye.
Opposed? Are there any abstentions?
One.
Abstain.
Two.
Abstention.
2.
We have 2, so 302, please. Okay, the next set of minutes is February the 11th. Do I have a motion?
Mr. Chairman, motion to approve February 11th, 2020 meeting minutes.
Second.
I have a second.
Abstain.
All in favor?
Aye.
Opposed? Abstentions?
Abstain.
We have 2 abstentions, 302. And then the last was February 25th, our last meeting. Do I have a motion?
Motion.
Do I have a second?
Second.
All in favor?
Aye.
Aye.
Aye. Opposed? 302. All of these, however, have one thing in common. Our recording secretary, Dawn Cathcart, they are just beautiful. Thank you so much. And please place that in the minutes. I appreciate it very much.
Use 3 exclamation points.
Use as many as you want.
Citizens' time. Is there anybody here who is not on the agenda? I don't see anybody. Chairman's report. I have a number of things. First, on March the 4th, we came before the Ways and Means, and they passed our budget unanimously. I just note that they were also gracious enough to allow us to make provide discussion on COVID-19, and Susan did an update. They allowed us to present a little bit of information on the future of the Board of Health going forward, and with all of the changes, especially over the past year, we may need to make some additional staff, maybe an additional budget in the future. We talked about that. And I want to just note again to those members of Ways and Means, they were highly professional, and I want to thank them very much for doing what they did. I need to thank Dr. Wayne Saltzman for his coronavirus update on BCAT, as well as he is our medical director and his outstanding advice. He even got some more today, so thank you very much. I need to thank Susan Luminello These are very strange times. With all of her leadership, she's at so many meetings. She calls me, and we speak multiple times a day. And I also want to thank everybody on the board and our staff for what we are doing to help protect this community during what is now a emergency. So,
State of emergency.
state of emergency. So, any other comments towards that? I'll take any now. But it's been a very difficult week and a half for everybody on this board and everybody on our staffs. Thank you so much. Subcommittee reports. We do have a subcommittee report, but we will hold it until we talk about the next agenda meeting, was an application for special permits for MEC, 20 North Ave Vulcan Forms. Would you please come forward? And please sign in. Please print for our secretary.
Good evening, Mr. Chair, members of the board. For the record, Christine Hung from Reamer and Bronstein, attorney for the applicant Vulcan Forms, Inc. Vulcan Forms is a cutting-edge additive manufacturing company that is looking to relocate their corporate headquarters to 20 North Ave in Burlington. They were founded by MIT faculty and alumni, one of which was a co-founder of Desktop Metals right here in Burlington. And similar with these type of companies, they all like to cluster together. And so they know, obviously, the co-founder was part of Desktop Metal. They're friends with people from Poly6 as well as Digital Alloy. The applicant is seeking special permits from the planning board along with a minor engineering change in connection with their uses. A few weeks back, we had a subcommittee meeting with the Board of Health. Lots of questions were raised, and since that time, we have been providing answers to those questions by way of a DCM meeting a few weeks back with the various heads of the committees, and most recently with a site walkthrough with the Chief Hannafin and several building inspectors that went well. The applicant has engaged the services of Triumvirate, which is a third-party safety consultant, to prepare safety protocols, emergency protocols, and those are in process. Additionally, at the DCM meeting, Chief Hannafin raised the issue of obtaining a license from the Board of Selectmen due to the quantity of materials. So that application is also in process with the Board of Selectmen, and I anticipate that will be before them within the next few weeks. And also lastly, Christine sent proposed set of conditions, which we've reviewed, and they are all acceptable to us. I'll turn it over to, so with me tonight, I'm sorry, I forgot to introduce Martin Feldman, the president and CEO of Vulcan Forms. I have John Warren, who is the vice president of materials engineering. And behind me is Anupam Goodall, who is the vice president of corporate development. So I will turn the microphone over to Martin, who can give you a...
Ms. Hung, thank you and Mr. Buckley for the update this morning. I really appreciate it.
Sure.
I just want to ask the environmental engineer, I have continuously seen approval of special permits, and we talked about some of those at the subcommittee, but how many of the special permits have we come up with that they need to be approved this evening?
4.
4. And just so everybody on the board knows, what are they?
Light manufacturing, laboratories engaged in research, experimental and testing activities, hazardous and toxic materials storage, chemicals use, generation or storage of hazardous waste, limited to the volumes classified as a very small quantity generator.
Okay, I'm sorry, but I just want to make sure that everybody on television knows and everybody here is aware now of exactly the four special permits. Thank you very much, Ms. Holmes. Please, Mr. Newman. Or is it Dr. Newman? Mr. Newman.
Mr.
Newman, please.
Thank you very much, Mr. Chairman. Good morning. Our company is applying for these special permits. We are a additive manufacturing company. Additive manufacturing is a novel way of manufacturing complex geometries. Specifically, we are making those out of metal. The biggest use cases lie in the medical field for human implants, in the defense and aviation engine businesses. So those are exactly the things that we are working on. And they require essentially bringing in metal that is powderized, pulverized. So you have a metal powder. You are processing this under inert gas conditions, argon. This is what one of the special applications refers to. And you are hitting that with a beam of light, which briefly melts that powder. And the areas solidify. You do this over and over again, layer by layer, thus adding more material, and you end up with a full part. And in order to inspect those parts, whether you made them correctly, whether they adhere to the very high quality standards in the medical field, in the aviation business, and in the defense field, you test those, for which we are finishing up our lab. And this is where I think one of those other special permits refers to the chemicals that we are using in there, moving forward to assure quality.
Okay. Anybody else on your team need to update?
The lab is a metallurgical laboratory. And in that lab, we have optical microscopes where we are able to take small samples from the builds that are manufactured in the machine. We take those small samples, we cut them, we polish them, and then we use acids to etch them. Etching brings out the microstructure so that we can then put it under a microscope, an optical microscope or a scanning electron microscope, and we can examine the internal structure of the material to see if it conforms to specifications.
Even to the point where you need such strong acids as hydrofluoric acid?
Yes. Titanium is very resistant to acid etching, and there are recipes that use very small dilute quantities of hydrofluoric. It is the standard etchant to use for titanium-based materials.
It was the one that caught my eye. Back in my day, we used it to break covalent bonds, so it's a extremely potent acid. You have a 500 ml, I saw amount, and you're only using 20 mLs a month. I saw that. So it's a small amount, so it just sparked my...
No, I understand. I'm very much aware of the dangers associated with contact of hydrofluoric. But what we are doing is we are using a dilute concentration of hydrofluoric. The bulk of it is DI water. We use a swab, a cotton swab, and we will take that dilute concentration, we will dip the swab into the concentration, and then we put it on the sample that we've polished. And after about a minute or so under the fume hood, it will bring out the microstructure.
Let me hold on to this because I want to talk about hydrofluoric acid.
I hope it's under a fume hood.
I think this is the time we need to speak, we need to hear from our environmental engineer on her report.
Sure. As Ms. Hung stated, there are several procedures and policies that are under development right now, and that's been addressed in condition 1, acknowledging that those procedures need to be finalized prior to operation. which would include a review by staff of those various procedures, such as training plan, HAZCOM plan, chemical safety plan, whatnot. And if deemed necessary, those, the applicant may need to come back to the board for an update on those procedures. We'll determine that after they've been finalized and submitted. And as part of that review and finalization, it would require an inspection by staff prior to occupancy being signed off on.
Okay.
And the updated chemical list that the subcommittee requested was supplied, and that's what you were just referring to, as were the manufacturer information for the metal powders and a preliminary metal powder storage plan.
Have you seen the conditions that have been
Yes,
put
yep.
forth? Have they agreed to these 10
They're fine, yep.
Okay, with the understanding that especially in proposed condition, or will be condition number 1, in which they may have to come back if our professional staff has a problem with any of the issues around any of those plans. And I hope that there are none, but if there is, then you're gonna have to come back and get them.
That's fine.
You do have materials like hydrofluoric acid. I always remember, and it's terrible, but I had a chemistry professor with one hand due to hydrofluoric acid, hydrofluoric acid. So, okay.
I'm very familiar with the potential dangers of the acid.
You know, and you have 500 mLs of that, which is a,
500 mLs. That would probably last us 4 or 5 months.
and where is that gonna be kept?
That's kept in a fire-resistant acid storage cabinet,
Which is locked?
always.
Okay. I'll take questions from,
So, Mr. Chair, if you wouldn't mind.
Please.
So, one of the, you mentioned that you were gonna be doing a site inspection prior to operation. I didn't see that in the conditions. Has that been added to the conditions, or do we need to add it to the conditions, I guess is the question.
It's standard operating procedure for them to receive a sign-off on their certificate of occupancy. I mean, you could,
I think only because we had some missteps
Okay.
come in, I think it would be good if we put it in as an actual line item in the condition. And missteps meaning that there was a occupancy permit that was signed off by another department in the town without us notifying. So I just think that we should put that in there, that in case something happens, that should be conditioned regardless whether or not they get occupancy.
do you want to add it to, as a separate condition, or add it to the
Well,
end?
maybe just add it to the
End of
first condition.
condition?
Yeah, that would be great.
And I just want to note for the record that the missteps were not anything that was intentional
Didn't
done
say
by.
there
vo-
was,
Yeah,
yeah.
no, and I know you didn't. I just want to just make it clear that it was
Sure.
just kind of, they
Yep.
thought that they were following all
Yeah,
the
no, I
protocols
understood.
and stuff,
So the second question I had, Christine, was during the subcommittee meeting, we came up that they are actually storing currently, although not in production, that they are storing some of these hazardous chemicals and materials, and we were looking for a hazardous, a storage plan. And I know they supplied one. I just want to make sure that you feel like it's adequate enough, because I know there was some talk and questions around that in the subcommittee meeting.
I think it's a good first draft. They do have limited quantities on site right now. As part of this condition number 1, we'll be looking for a more robust metal powder storage plan and other chemical storage plan.
Right.
Because this one just addresses the metal powders, so we'll be looking for non-generic
Gotcha.
storage plans for other chemicals.
Are you happy with the metal powder storage plan?
For the limited quantities they have on site right now, yes.
Great.
so the
So, yes.
fire department.
And
In the
fire department reviews
So
that as
can we
well.
put that as a condition, that they can't bring other product on site until you're satisfied? I mean, I just want to make sure that we're, because, right now they're storing, and
What's on site now?
there's titanium, I believe.
Oh, so
Powder.
just metals are on site
Just
now?
metals.
Just the pulverized metals are on site?
On site?
No,
Yes.
no
Yeah, the 40
chemicals, no
pounds.
acid?
Of what is on the, yeah, so we have titanium powder on site.
Which is explosive.
Yes.
It is a flammable, yeah. We have,
Is it flammable or is it explosive?
I don't think that the MSDS rates it as an explosive. The MSDS also doesn't rate it as a flammable, but I think that under the right conditions, both of those things can happen.
And we're just trying to make sure that all the safety measures, the buck stops here. Once we're happy about this, you won't have any other problems unless you fail our yearly, is it yearly inspection? Yes, please.
So, Christine, this isn't our first rodeo with regard to this type of production, the aerosolization of metal powder, et cetera. So, and we have had no issues with the other, is it desktop?
Desktop.
Yeah, desktop. So we've had no issues there, and are they serving as, is this in our town serving as kind of a foundation of what is going right for us to reflect upon as we're looking at, and I don't remember having to deal with any of the chemicals and things like that with them. I don't recall that.
Well, I think before they stored chemicals on site, they were in front of us with the plan already.
But we've had, so what's my question? Are we using them as a template for this group, or is this totally separate, novel?
They're a good template.
Okay.
They do, their handling is a little bit more, the powders handled here in the format they're handled are under inert gas, and in certain circumstances, desktop does handle loose powders, so it is a little bit different in that regard.
Okay.
But we have not had any incident with desktop metals, and their plans are great.
No, I think, though, that we're holding each company to their own standard.
Yes.
I think that's really important. And I don't know if it's a good thing or a bad thing, but you're the first in that type of a industry, which is different from other industries.
No, and we want to keep everyone safe. We want to keep the
And we're
community,
happy
the
to have you
employees
here.
safe, so it's a collaborative effort to.
We're happy to have, that you're coming to this town, but it's just that we have our standards too about, we've had our issues in the past, over the past 100 years or so now, with contamination and with other accidents, so, please.
Oh, no, I was interested in the subcommittee report.
Oh, please.
The chairman and I had a subcommittee meeting back in about a month ago or so ago. And actually, it went very well. Happy to have them in town. These are we say this all the time, these are the types of businesses that we love to have come into Burlington. We were concerned, I think, during the subcommittee meeting that they were storing metals before they came in front of us. And we talked about submitting some storage plans, as well as they're working with a consultant for safety and incident management plans, emergency management plans. So I think we're on the right track, and I was happy to see that they submitted the hazardous storage plans. Susan did have raised some issues around how they were storing, and I think they've addressed some of those as well to make them more effective or make you more comfortable with it.
So, yeah, I think one of the main issues was with the building and fire departments.
Right.
Because they were not aware of what they were storing when I had talked to them. So we made them aware, and then we held a departmental meeting so that all the departments could get on board as far as what was going on. The building department had done a review, and they determined that they do need to add something to the building because of the storage of the titanium. And the building inspector assured me that they will not get occupancy until he's satisfied with putting in this wall. I don't want to call it a firewall, but it's some kind of wall of separation for the storage of the materials.
So I don't want to be a dead horse here. Why would you guys do that? Why would you put stuff into a site
Well,
where the
in the-
fire department and police department, nobody knew about it? We didn't know about it.
So that was one of the missteps that
defensive Vulcan
yeah.
forms. They didn't
So
know,
they
and no
didn't
one
know,
called.
and it wasn't, they weren't told that they had to go through the planning
They
board
went through the
process
proper
to get
procedures, the
special
building department
permits.
signed off on it, there was a misstep by the building department, didn't notify the Board of Health, that they were opening, we've since addressed it.
Okay.
So it was kind of
All
like
right.
a backwards process, just,
And
you
we're
know,
trying to,
right the ship.
get them up and running as fast as possible, but within, obviously, the safety of the community
Got it.
and the town. That's why we wanted that, handling plan, management, storage plan pretty quickly. And when I think we went back and forth to make sure that we're comfortable with it. Susan had some concerns with how it was being stored, because it was stored out on open shelving. I think we've addressed that.
In the
In the
sprinkler
fire-
system,
in the sprinkler
you
system,
know,
too.
so, but I wanted the building inspector to be okay with that first, because, and he was, he said,
course.
he went out, took a look, and he said he was okay with it being sprinklered. He just wanted the addition of that wall.
And I did talk to the building commissioner, Andy Ungerson, and we're going to do a code review. He just wanted to make sure, even though it was originally done, just to confirm everything. So, you know, they're going to be doing a code review just to make sure, you know, the walls are as it should be, and, you know, if anything needs to be added or done. So that's in process as well.
So we're trying to get them fast-paced, moving
Got it.
quickly without
Got it.
penalizing them, because certainly.
I got it. No, I got
One of
it.
your staff members would you like to say something?
No, I just wanted to add, like yesterday, the building department and the fire department did an entire walkthrough. The entire facility, we showed them everything, showed them how powder is stored, demonstrated the entire process of how it's going. And the only suggestion that we got after the meeting was mainly the code review under the hazard group 2, which we were classified under, which the entire thing was done. They just want to re-verify that we meet those, the same hazard group 2 standards. And we engaged Marvel, the architect which initially did the plan, and then we resubmit the documents. And that's the only thing that we feel regarding from the building department. The fire department chief, he saw everything, and as Christine mentioned, regarding the selectmen, we've already reached out to them regarding metal powder storage. And once we get the approvals, we'll go forward with that.
Either you have any comment?
You know what,
The public, the plumbing inspector was there as well. The plumbing
Okay.
inspector was there as well.
Thank you, that's good.
Thank you. Ed. I did have a question earlier. I spoke with Christine, and I thank her, because I think with your expertise, you kind of saw that this had a slip. So thank you for that. Thank you. We have you on the staff, and you worked, as you said, collaborating with them to help move it forward. And I did have a question on the powder, Ed, and I think the subcommittee addressed it with
Thank you.
Christine, so
Good.
I'm fine. Thank you for asking.
You all set?
I'm fine.
Okay. So, is there any other comments?
No.
I just want to clarify the change to the
Yep.
conditions. So we're adding to the end of condition 1, Board of Health staff shall perform an inspection prior to operation.
Correct.
Then the second, do you want to add a second
And
one?
prior to giving an occupancy permit?
Prior to operation and occupancy
See
permit?
Yeah,
Okay.
Well, you can't have one without the other, right?
well, can't, but I just thought it would spell it out,
Yeah,
since there've
no,
been
that's
so
fine.
many
This is a little bit redundant, that's fine.
Yeah, that's fine.
redundancies, okay.
And is there anything else you wanted to,
There was a second one, but honestly,
I think it was it regarding the
They-
fire department license?
No, that wasn't it.
They just know that they may have to come back to the board as well.
no, there was something
That
else.
wasn't it either.
Okay. Anything,
Do you have what it is, do you have what the other, yeah, he's, yeah.
Is it for storage? Because I think that was just a draft that you saw, right?
Yeah.
Do we need?
I have nothing.
That no other product be brought on site.
Oh,
right,
no
yeah.
additional
Till-
product.
Until additional storage,
Or
yeah.
additional quantities.
Right.
Yes, okay.
Additional chemicals and additional quantities?
Additional chemicals.
Quantities, I don't know about that.
Additional
I think she
chemicals.
means of quantities of the existing.
Right.
what's
Right,
Right,
right.
they have their existing, and
They
if
have
they're
a
gonna
little-
up the, say double the hydrochloric acid.
Hydrofluoric, yeah.
So let's say they currently have 10 pounds of titanium powder on site. They're not to bring more titanium powder on site until these plans are finalized.
Yep.
Is that-
Yeah, but I don't want them to bring any other hazardous
That's what I
materials
said,
on
that's
site
what I said,
either.
hazardous materials, quantities, or additional chemicals?
Well, doesn't the material safety, it indicates the material, obviously, but does it indicate for a certain quantity as well? That's not what I mean. Does the permit to have these things, is it quantity based?
Yeah, so the fire department permit is that correct, Christine?
Yeah, but we're talking about this interim period between now
Correct,
and,
yeah.
like, operation. So it's
Right.
like, what they have on premises now, they won't bring any more on.
Correct.
Is that essentially
Correct.
what we're getting at?
Yes.
Yeah,
So-
up until, like, operation, and then they
I
can
thought-
just operate how they would normally operate.
Yes.
Thank you for the clarification.
Oh, sorry,
I-
yeah,
I
you thought meant
Yes, I thought you
definitely.
meant in general.
No, no, no,
Okay,
no.
thank you.
How about they don't add?
Until they get their,
the
until they get signed off
chemical-
from the Board of Health.
Yeah, they don't
Yeah.
add to the chemical inventory or quantities
Okay,
that are currently existing.
and that'll be part of one also.
Condition one.
Condition one.
The applicant shall not add to chemical quantities
Or inventory.
or inventory.
Okay,
So that, with Mr. Chairman, I'll make a motion to approve a recommendation for application, special permit.
do we need to take
Do we need
these?
to do 4?
There are
Do we
four
have to
of
do
them.
four separate
Do
ones?
we need
Or
to
do we
take
don't?
these
I don't think so.
individually?
It's one special
You can do
permit.
this
One, is it under
Well,
one?
you can do one vote for all of them if you want to do.
Yeah.
One vote for all of them, and to just, one is for the light manufacturing, one is for the laboratory, one is for hazardous materials, and one is for storage. Am I correct?
The fourth one is for generation of hazardous waste.
Yeah, oh, hazardous material, hazardous
Or you
waste.
could just say 1.51, 1.5.2, 1.5.4, 1.5.5.
Yeah.
So I'll make
Like,
a motion
Let me
to-
just make sure
Go ahead.
everyone knows.
Yeah.
1.5.1 is light manufacturing. 1.5.2 is laboratories engaged in research, experimental, and testing activities. 1.5.4 is hazardous and toxic materials / chemical use. And 1.5.5 is generation or storage of hazardous waste limited to the volumes classified as a very small quantity generator. So we're going to take them together. Do I have a motion?
So moved with the changes to condition one.
Second.
A second, Dr. Saltzman. Is there any other discussion? I think we're all on the same page now. All in favor?
Aye.
5-0. Thank you for coming.
I just want to say thank you very much for your, the subcommittee meeting. Christine, thank you so much for being collaborative, answering questions, and just being, just being very helpful throughout this process. So,
Thank you.
thank you.
Thank you.
Thank you, Mr. Chairman. Thank you,
Good.
Board.
Thank you very much.
Good luck.
We wish you well. Next agenda item is discussion, King BB's 45 Wynn Street. You may remember during our last Board of Health meeting, we had a long discussion over issues around this institution, and there have been some changes. Our health agent, Ms. Johnson, will tell us
So I just
about it.
wanted to inform the board that Mr. DiPaula has sold his business, and so that makes the order null and void. I did meet with the new owner, and he came and met me at the office, and he's very easy to communicate with. He's enthusiastic, and he wants the business to be successful. He was unaware that there was a bad inspection prior to him purchasing the business, and he didn't know that the owner, order from the Board of Health. He was willing to voluntarily hire a food consultant to do some training. And so at this point, I know he has met with the food consultant. So that's up to him at this point. And he's due for a routine inspection by the end of this month. So I did make it clear to him that if any of the conditions that were found under the last owner's management, that I wouldn't hesitate to bring him before the board. So he understands that. So I don't think we'll see him before the board.
So everything we did before is moot at this point? Okay. And is it still King BB's? Is it still
He
the
is-
same, is it the same product? Same food stuff?
It's a bakery, yes, so they'll have the same product, but the name will be changing if it hasn't already.
Do you know if it's a a family member that
They're
purchased?
not related.
They're not related.
I did ask that question, not related at all.
And are the new owners ServSafe or whatever certifications they need to open the business?
His had expired, but he
Gotcha.
had at one time, so at least I know he has food safety training.
Right.
But that was part of him meeting with that food consultant to get everybody up to speed with their certifications.
Great,
So
okay.
is it because, do you think did it have anything to do with the issues you think that led to this, or this just,
No, from what the new owner told me, it was financial. He had some financial issues.
okay.
Thank you.
You're welcome.
So the new owner knows what was wrong before and
Yes,
can fix it?
he did see the inspection report, yes.
And they know that they have to have somebody who is trained at all times.
They
Okay,
do.
very good. There's nothing that we need to do because it's a
Nothing we
different
need to do.
institution.
Right.
Now, what I think all we've been waiting for is a discussion on our novel coronavirus COVID-19 response actions. I think that we all know that there've been a lot of changes since, I think it was 3:52 this afternoon, when our governor has declared an emergency.
State of emergency.
State of an emergency due to the COVID-19 virus. So I'll turn this over to our Director of Public Health, who has been getting no sleep at all.
Okay, a lot has happened in the past 2 weeks, so I'm just going to try to go through what we've been doing, what's been happening. On your board book materials, there is, one of the links under this is all the materials that we've worked on and that we've put out there. There's also the BCAT interview or special, I guess, or update on coronavirus by Dr. Saltzman. So I'll just start going through this now. So coronavirus, or novel coronavirus, also called COVID-19. COVID-19 is one type of a coronavirus that's believed to have originated from animals. So other coronaviruses are SARS-1, MERS, and SARS-2. The symptoms, fever, cough, shortness of breath, and then in severe cases, it can develop into pneumonia or fluid in
Excuse
the
me.
lungs. Yep.
Just to let BCAT know, we are projecting your presentation if it's available to the public.
Do you want me to hit the lights on that, or is that okay?
Yeah, maybe you should cut the lights down a little bit.
So I just want to augment the director's, the first point. Coronavirus is the infectious agent. It's, COVID-19 is what is the disease that the agent coronavirus causes. COVID-19, COVID, coronavirus, disease, 2019, COVID-19.
So how is it spread? Person to person, close contact. So close contact is considered within 6 feet for a period of 15 minutes. And it's through respiratory droplets when someone coughs or sneezes. Also from infected surfaces. So it's possible that someone could touch an infected surface and then touch their mouth or nose. The time frame is not known how long it will live on a surface, but if it acts like the other coronaviruses, then it could exist for a few days. Was symptomatic or asymptomatic, so there's some evidence that it could spread before people are showing symptoms. However, it's when people are sick that they're the most contagious. So where are we now in Massachusetts? As Dr. Weiner said, Governor Baker declared a state of emergency today. So these are the numbers that I pulled off DPH last night, which are no longer accurate. They haven't updated their website as when I looked at this earlier. So today we had 51 additional presumptive positive cases, bringing the total number of cases in Massachusetts to 92. 73 of those cases are related to the Biogen conference or contacts of those people, and 4 are travel related, and 15 of those are currently under investigation. So in the conference call today, Commissioner Burrell said that they believe they are starting to see community spread. Most likely the reason why they're, the state of emergency declared today. Here's where we are in the country, and again, this is pulled off from the CDC site last night. So as you can see, Washington and California are up there with the number of cases, but we're getting pretty close to be in that category. Commissioner Burrell said today that they have 2,000 test kits at the state lab, and they're expecting to get more. So they're going to be doing a lot of testing, and so we may see these numbers go up daily or every other day or so as they come in. It takes them 24 hours for to declare a case presumptive. So we're working on, in the last 2 weeks, we started working on prevention strategies as far as what can we do to prevent people from getting this illness. So we started with messaging. So anyone can go to burlington.org and click on Public Health Alerts at the top of the main page, and it'll take you to the Board of Health page. On our Board of Health page, I'm updating that constantly as new information comes in. But a lot of the things that we have on there are helpful links. So that way, because the links get updated constantly too. So I'm not putting all the information on that page. I'm relying on links for that. We will be directing the public to this page through the lighted highway sign. So that should be going tomorrow. Trying to get the public knows this page is there. We're doing posts on social media. Public service announcement was sent to local media as well. So all about trying to get people to go to the site. We're doing a weekly, or Dr. Saltzman is doing weekly updates on BCAT. And as I said, the first one has been posted in your board book materials. We have social media pages, so the Twitter account for the Burlington Board of Health and for the BVRC, and the BVRC Facebook pages. We've been getting messages up on those about proper hand washing and messages around just respiratory etiquette and things like that. The town sent out a letter to town employees from the town administrator with information on the Board of Health website, prevention strategies, and town resources. So that I included in your materials as well. The school superintendent sent out a letter to parents with, again, the Board of Health website and prevention strategies. The CDC Learn the Facts, Stop the Fear posters, those ones, we're disseminating them to food service establishments through our inspectors. We display the town website and prevention strategies on digital signboards in the recreation department. We have poster displays and handouts with the latest COVID-19 information at the Board of Health office, the town hall, the library, and the senior center. So we have these 4 tables around town with information on COVID-19 and the latest updates. We're putting on those as we get them. We had hand wash signs posted in all the restrooms at all town buildings. So what is the message? So the message I'm sure you've seen on our website, wash your hands, use respiratory, cough into your sleeve, the things that I went over with at the meeting with Ways and Means. So you can see all of those things that we're trying to get out to the public. Things like avoid non-essential travel, and we're giving information on what countries to avoid and CDC travel advisories. So I wanted to talk a little bit about isolation and quarantine and what the difference is. So isolation being you're sick and you need to stay home, avoid contact with people until you are no longer showing symptoms. Quarantine is that you're feeling well, but you came into contact with someone and you're now staying home for 14 days, but you're asymptomatic. So we have gotten information, we get information from the state on people who are quarantined from China and Iran. And people that have come from Italy, which is also is also a level 3 country, they're being asked to self-quarantine, but we don't get the information on those ones. CDC has not provided that information. So there's people quarantined for travel. You can be quarantined if you come in close contact as well with a person who is sick. So there's active quarantine and self-monitoring quarantine. That's kind of what I said. Active monitoring is when the Board of Health nurse is calling you and saying, how are you feeling today? What is your temperature? They're sending us temperature logs, and we're checking up on them. The self-monitoring is, we don't know about them. They're doing it at home because they traveled to a certain country. And those countries are Italy and South Korea. We're notified of cases through Maven, so we get that information all electronically. So a little bit on the collaboration with the town administrator and Burlington's emergency management team. So I met with the emergency management team and provided a situational awareness briefing. It must have been last week, so beginning of last week. And we've come, a lot in that time, but I just wanted to get everybody aware of what the situation could be and start thinking about what's going on. And I'm continuing to collaborate with the town administration and then the various town departments to start thinking about implementing strategies, things like reaching out to employees regarding sick leave, employee protocols for conducting home inspections if people are going into the home or home visits. Signs outside of town buildings, so that's one thing we're going to put up tomorrow, a sign that says, if you're feeling ill, you don't have to come into a town building. You can do a lot of business online, so it's a description of the business that they can do online. That's also in your materials. If they're feeling sick. We met with facilities for the schools and for the town to give them information about cleaning procedures and reminding them to do regular cleanings. I mentioned we had the hand washing signs in all the restrooms. We also put up the DPH COVID-19 signs, the facts. So we're having, I'm providing regular updates to the emergency management team as well. We met with the department heads, all the department heads, to give them this information, have them start thinking about things like if someone comes into the building and appears to be sick, you want to stay 6 feet away from them, wipe down their counters often, that type of thing, and not to come to work if they're sick or not feeling well. I had regular individual meetings with the Council on Aging, the DPW, the Recreation Department, and Youth and Family Services about things that those individual departments should be doing and maybe about things that they should be thinking about in the future if this continues. So now with the state of emergency, we're going to continue with our prevention strategies. And now we need to start thinking about mitigation measures. So one of those would be, one thing that we really need to start thinking about is our continuity of operations. We need to make sure that, if one sick person walks into a department, it doesn't get all the people in that department into quarantine. So I'm working with the emergency management team and the town administrator to see if we can find solutions around that to prevent that from happening. And also measures to take to continue our essential operations if we have decreased staff. So departments should be thinking about, okay, what are our essential operations and how are we going to carry them out if our staff is decreased? And then the recommendation of cancellation of activities. So that today, I had this up here yesterday, but now we've had a lot of calls about that, asking should we cancel this activity or that activity. And with the governor's directive today, I would be more prone to recommend that people cancel activities now. And the school department had sent out reverse or code red call tonight saying that they were going to be canceling a lot of their activities, things like concerts and I think it was a trip to Disney and things like that. So that's a lot of what we've been working on in the past week. I don't know if anybody has any questions or comments. I'm meeting with the emergency management, so after today, we have a call with DPH tomorrow for local boards of health. We're gonna talk about the new guidelines, I'm sure, from DPH, which will come out tomorrow. So we have to get a handle on what those new guidelines are. I'm sure there'll be a lot of questions on the call about them. And just starting to implement any new guidelines that we get. And then on Thursday, I'm meeting with the emergency management team again so that to make them aware of what the new guidelines are and how they can start implementing them.
Any questions? I will say that to the public, how well the town departments are working together. Police, fire, the schools, DPW, I could go on and on. Everybody is following your guidance. Everybody is working together and keeping this town safe. I want to single out Mr. Sagarino, our town administrator, who I met with just a couple of days ago, and he committed anything that we need to keep Burlington a safe place to live and work. And I want to thank Mr. Paul Sagarino. But most important, Susan Luminello and her staff have stepped up. It has been total leadership, and I want to thank you, the staff here, and everybody in your office. Thank you so much. Now, anything?
So, Mr. Chair, I just want to echo a couple of things that our director just said. First off, our director is fabulous, and I have absolute faith in what she is doing and for our town, and I thank her for all of her efforts and her efforts to come. I also want to say that I trust our governor implicitly, and he has really kind of proclaimed an essence of calm. And I think that's really important. If you get flu-like symptoms, fever, cough, etc., this concept of self-isolation is very important, keeping yourself at home. Remember, it's still cold and flu season. It's, fever aside, allergies are starting to come into play. So keeping yourself isolated is great. If you get short of breath, that's a different story. You should call your doctor. Don't show up at your doctor's office expecting you're going to get tested for COVID-19. They don't have kits, and the likelihood of spreading illness becomes that much more significant, and it could create a significant issue in your doctor's office. Call first. Your doctor knows what to do. I also want to say that I've been impressed with our Senator Friedman, who has really been, I've read some of the legislation that she's been part of, and I want to thank her for that as well. Our government is doing a good job. Staying informed is crucial. Our government and how our director has digested what the government is saying into packets of information that are understandable and are up to date. I think that is the best way right now that our community can stay informed. Check on the Burlington website. Our director is doing a great job of taking a lot of information and getting the facts down that we all can understand, because there's a lot of information and a lot of misinformation. Our director has the correct information. Mr. Chair, I believe, even though we talk about this all the time and we even jest about it, I believe that we have a hand-washing epidemic problem. People are not washing their hands, which is the biggest way in which we can spread any illness. And I know that because I've seen it. Please be diligent. Use the handheld sanitizers. I am remiss to think in this room we don't have any handheld sanitizer. except for a small bottle by our, so that's great. But using those, but the recommendations are to wash your hands. And I mean, you know, they're talking about 20 seconds of warm water, lather, and, you know, really doing a good job. So think about that. 20 seconds to reduce your risk of spreading or receiving infection, I think is huge. I was on a plane recently coming back from California, and I watched somebody do this, and I did this on BCAT. Achoo. And then touching stuff. Really, try to isolate your cough and your cold. I've been seeing it on the tea as well. So, you know, really do your part to try to limit as much as we can. Masks out in the public, the CDC has spoken, and it is true, those masks are not going to protect at all. If you are ill, and you're going to be in the presence of others, let's say you're coming in for a checkup, whatever, then the mask you pick up at your doctor's office may help reduce that droplet spread, but wearing those masks in public is not going to help. And the concern is that by taking up all of these masks that aren't helping in public, we're depriving medical professionals and offices from having the masks that they may actually require. I think that's what I just wanted to say. You know, and Mr. Chair, I have to apologize. I corrected you twice regarding emergency versus state of emergency. Our governor very clearly said, obviously, we're no longer low risk in Massachusetts. Our risk has increased, but a state of emergency is just a way in which the state can utilize more funds, come up with better plans, and have more power to do things like canceling events. So state of emergency is different than an emergency. And so I just want to say the idea here is still to remain calm, stay informed, and do everything you can to protect yourself and others. And I will be doing an update on BCAT tomorrow and every Wednesday as we move along.
And I just want to point out also, the estimated severity of the seasonal flu is high.
That was going to be my point, actually.
And I think that's very, very important. There is still time for you to come to the Board of Health, to call, and to get a flu shot. And I'm not sure this is misinformation, but I'm pretty sure this is true, that we are approaching 18,000 deaths from the seasonal flu in the United States. And that's growing every day. So please, if you haven't got your flu shot, get your flu shot.
And the chances, if you do get sick, the chances are that it's going to be a cold or the flu versus the coronavirus.
So these are some important things. Getting the flu vaccination is crucial. Those people who get the flu vaccination have a 45% decreased risk of getting the flu compared to those who don't. But as we know from all the discussions that have gone on, as Mr. McSweeney is intimating right now, 80% of those individuals who actually have the coronavirus are going to have mild disease, which leads me to the other issue that our director is working with the Council on Aging director with as well. We need to protect our older adults. Older adults with complex medical issues are more prone to this illness if it is in the community, and so we really need to make sure that we are keeping them healthy and as much as possible, and helping them keep out of the limelight, so to speak. So. Flu vaccination, crucial. 80% at least are not going to have any repercussions from this illness, but our older adults we need to watch out for.
And one other thing, we do realize that hand sanitizers are not readily available anywhere in the grocery stores, in many of the hardware stores that people are going to, as well as masks. We've seen on the internet the gouging of individuals who are looking for these types of products. Our town public health nurse saw one ad for $75 for a couple of masks. Please listen to what CDC has recommended, and please wash your hands.
Plenty of soap. There's plenty of soap.
Plenty of soap available. And if you have any questions, that's why you have a Board of Health. That's 781-270-1955. Feel free to call that if you have any specific questions. But we have no sanitizer left to give, and we have no more masks than we can spare. It's a terrible situation, but we do not have those products. And I know a lot of people are calling, asking us where to find it, and from what I see, they're not readily available anywhere, and we don't have them in stock. Wash your hands. Any other?
I just have one question. Talking about cancellation, Susan, just for the health fair, is there discussions with the board at this time and your staff?
Next
I
discussion.
did talk to the chairman about that, and I do think that we should cancel the health fair. So that's one thing that we have to work on. And I also think that we should cancel our talk on Monday on the radiation safety that Jennifer Reardon was gonna do. Not cancel it, hopefully postpone it. Yeah, I think we should.
Yeah, I spoke with the director earlier today, and I just don't see any way, given the state of affairs currently, where where one, we could safely have this health fair, and two, people would actually even come.
I was thinking, and that's what.
And vendors
people
are
ask me.
actually
Well,
pulling
they
out appropriately.
Right.
Understandably.
Yeah.
So I think, I'm hoping we can postpone it for a later time. I defer to the wisdom of our director, but I think at this time, we just, this is just the state of the state currently, and I just don't see any way we can do that. Before today, if today hadn't happened, if we hadn't had the more than doubling of cases, I would still be thinking low risk. I would still be thinking kids okay to go to the aquarium. I'd be thinking all those things. I'm not thinking anything like that anymore. So it's a different world right now.
I really think we should take that burden off of the Director of Public Health when it comes to the health fair, and I think we should vote tonight.
Mr. Chair, I make a motion to postpone, I'll say, the health fair until it's a safer time.
And any other meetings that our director feels should be postponed.
Okay, I'll go with that.
Okay?
Second.
I have a motion, a second. All in favor?
Aye.
So you have a direction. We're leaving it in your hands.
I'm sure you have a few other things to do.
Yeah.
But you have some resources you can pull from as well.
Yes.
Anyway, if there's anything else around the coronavirus, if nothing, we'll move on. And again, feel free to call the Board of Health. The Environmental Engineers Report. You're up again.
Okay. Couple of updates. Working with the DPW and their consultants to kick off the construction of the new DPW facilities on Great Meadow, and they're starting at 10 Great Meadow, where we're scheduled to do the demolition inspection coming up this week, tear down the first building, and then the second building on that site next week. I'm currently at the tail end of the annual renewal of hazardous materials registration forms. That's approximately 120 companies that annually update what they have on site for hazardous materials through the filing of their HMRF. And those are the same companies I inspect annually. Those are all due in Monday. So we're tracking those down. And final note, I'm assuming we'll be able to hold household hazardous waste. And if we are able to hold it, because it's outdoors, it's scheduled for Saturday, April 18th. And I'll take any questions.
I have one question. What is the status, just so everybody understands, the status of the water ban.
Oh, yeah.
The status of the water ban is, right now, there is a full water ban, which means no watering.
No?
It is subject to potential change at the beginning-ish or mid-April, and at which time they may go back to a every other day watering scenario like we had, last spring and fall, through last fall. And it's because of, we are required, because of the connection, the future connection to MWRA water, to have a full water ban in place over the winter period.
And
Mr. Chairman?
So the DPW website has the most up-to-date information on that.
I think that we should, that maybe you should give a call to DPW around the beginning of April and make sure that they do a reverse call with everyone in town so they know it, because the full water ban includes private wells. I'm
I will do
sorry,
that.
did you-
No, that's fine. I'll wait.
did you-
Oh, I was just gonna ask if they'd done a reverse 911 call, or whatever you call that thing,
For the has the
for the
DPW?
water ban, because I was under the impression we were still odd even.
I don't know. I don't recall receiving one.
There wasn't a long list of them on mine,
I'm not watering.
or in my long list. Okay.
That will come out of the selectman's office.
Okay, my other question is, when is this going to be finalized, this hookup to the MWRA? So we're out of this yo-yo stuff.
It's in the permitting process right now, and it's my understanding that there's two phases. One is the emergency connection to the Lexington line down Adams Street. And based on what I saw most recently on the DPW's website, that's 12 to 18 months till that's complete. And then the full phase.
That's the second 12 to 18 months before that's complete. It seems like
It's a
it's
long
been,
process.
It really is,
it's like gonna be 4 years or 5 years before we get it.
probably. The connection, the full connection to the MWRA water supply has to literally dig up all the way through Lexington and all the way through Arlington. So the permitting process to achieve that is monumental. And right now, the draft environmental impact statement, the environmental impact statements, I believe, just came out recently. So, I mean,
Wow.
I can ask for an update on that when I talk to the DPW about the water ban.
If you could, that would be
Yep.
great.
Mr. Chairman, I just have one question for Lucy. Christine, can you just share just a little bit of details of the investigation for 198 Wynn Street stormwater?
So it turns out that is basically just, it was noted during a colder spec. We had a call into one of the board members that there was some icing along Wynn Street. I went out and I took a look. It was not nearly what we had seen last year along Cambridge Street, but there was a, 3-foot wide by maybe 100-foot long patch of ice on Wynn Street. I spoke with the DPW. They were well aware of it, and it's been a repeat problem for, I guess, a number of years now. And they were actually, it was already on their list of locations to treat that day. And it did get treated. I did confirm that. But it is believed, however, that it's simply an outcropping from the ledge behind that portion of Wynn Street, and not anybody, dispelling water onto the street from a point source.
So it's just something they have to treat yearly yeah.
That brings up a good reminder, coming into spring, summertime. I don't know if you can talk briefly about stormwater and sump pump disposal in proper way versus the
Sure.
proper way.
So our stormwater regulations require that the discharge from your sump pump has to infiltrate that water on your own property and not impact any public ways, or like sidewalks and roadways, or impact your neighbors in any manner.
That includes pools, pool covers, sump pumps.
Well, sump pumps are specifically addressed by our
Right.
regulation. Pools are allowed to be discharged to a storm, to the storm sewer as long as it's dechlorinated and you have prior approval from DPW, I believe, yeah.
DPW?
Yes, you're required
Yeah.
prior approvals.
Thank you.
Ideally, you would infiltrate the dechlorinated pool water on your own property as well to reuse the water.
You have any other questions? If not, I'll have a motion to approve the environmental engineer's report.
So moved.
Second?
I have a motion, second. All in favor?
Aye.
5-0. The health agent's report.
So we had our food code review last month, and we had 81 people attend.
Wow.
And they represented 73 food service establishments. So that was about 46%, which isn't really bad when you come down to it. We're pulling these people out of a busy restaurant to come here. So Christine did her presentation, chemicals in the workplace. I did a presentation about grease traps, and Samantha did a review of the food code, some of the common violations with the new food code requirement. So it was good. I think we gave them a lot of good information, so.
That's great.
All the indoor pools were inspected, and there were no issues found. Any issues that were found were taken care of. And the mobile food establishments, also known as mobile food trucks, the renewals went out. All of their permits expire on April 1st. I haven't received any renewals yet, so I'm hoping that there'll be some renewals. But that's where we stand with them. Any other questions?
So, if it's a little chilly out or there's a little construction going on, mice want to be warm. Is that a bad thing to see a mouse in a food establishment or something else like that?
A lot of the sightings that we received complaints about were seen in the dining room. And we do go out on these complaints, and we don't find any evidence of any kind of infestation. We don't find mice in the kitchens, in the food storage areas. They like Dr. Saltzman said, that they'll go in because they want to find a warm place. There's a lot of construction going on in town, so it disrupts their outdoor home, and they scatter, and they try to find a new home. And if they get into a building, and they can easily get into a building if they gnaw through some of these weather stripping on the door. So once they're in, one of the problems that we're having in town is with the movie cinema. So they're not in the concession, they're not in any of the food storage areas, they're in the cinemas. And so they're working diligently with their pest control company to eliminate that problem, replacing weather stripping on the door, and trapping them and getting them out of there. So I think once the construction settles down and stops, I think that we won't see these problems anymore.
I have one question, or one actually observation. You had multiple complaints about hand washing at the mall.
I was just going to bring that up.
I think that's wonderful that people are calling you and noticing hand washing or the lack of in some of the concessions at the mall. Do you feel that this is something that has become rampant or just at this one institution?
I think it's isolated. In fact, the complaint you're talking about, actually, there were two complaints at the same food court restaurant. So I did speak with the owner, and I brought it to his attention. And so he was there for my re-inspection, and he told me that he reviewed everything with all of the staff, because he took it very seriously. He doesn't like to hear the customers complain, and they call us, but he was grateful that I reached out to him to let him know of the problem.
And if you get more calls from this food establishment, I think they need to come in to the Board of Health for a discussion here at a meeting. Not necessarily now, but if you continue to get these complaints from this one establishment, I think they need to come in. That's the only way that we can enforce is by making them understand on camera that this is not appropriate. Thank you.
So noted.
Any other questions? If not, I'll ask.
Mr. Chair,
Oh.
I make a motion to accept the health agent report.
Second.
I have a motion and a second. All in favor?
Aye.
5-0, which brings us last to the Director of Public Health.
So in my report, I mean, there's a lot of information on the early COVID-19 stuff that I was doing, but I just kind of wanted to draw attention to the MRC Technical Assistance summary. So this is what I got back from ASPR regarding our technical assessment for the MRC. So I think we did really well, and I just kind of like that she said that we have low visibility outside of our jurisdiction, but she thinks we're a sleeper. So I think a lot of people don't know about the stuff that we do. So, you know, once things calm down, maybe looking at maybe doing some MRC well check webinars and trying to, I think it's going to get canceled, but I was scheduled to go to the NACCHO Emergency Preparedness Conference at the end of March, beginning of April. And there I was going to actually present with Doug Kress, the Director of Health in Somerville, on our last year's work on emergency preparedness. But I was also going to attend the MRC Leadership Summit, which they have once a year there. And unfortunately, I think it will get canceled, but you know, that would be a good place to kind of share the type of stuff that we're doing at our MRC with other MRCs. So any opportunity that I can get, I think it might be a good thing to kind of share what we do.
So Susan, one comment. I mean, great write-up. You know, I love the last, I guess, sentence that says this is a model unit.
Yeah.
And that's all you, so really thank you for all the work. This would not even be in existence if it wasn't for your leadership, so really appreciate that.
I wholeheartedly agree. We talked to Ways and Means about the possibility, if the workload continues to grow in this community, about bringing on an associate director to take some of the burden of the MRC, some of the burden of all of the state of emergency situation off your plate, and for you to be able to just lead. And I planted that seed because it's going to soon become a necessity with 326 food establishments and 120 hazardous materials and inspections and everything else that's going on.
You know what I like
Very
about
much.
you know what I like about the Board of Health in Burlington? We're not in your face, but we're constantly working in the background, and when you need us, we're here. And testimony to your office. Thank you very much.
And everybody, and staff too. I
I said her office.
Yeah, the office, but staff too. We have quite a staff here.
Staff, too.
We really do.
Yes, we do, and staff has really stepped up to help. Some staff members, you know, are helping. Samantha's been a lot of help. Sarah's been great this week. Kathy's been out on vacation for the last 2 weeks, so Sarah's really been stepping up. But it's also the other staff members in doing the things that, you know, I can't do, in taking on that extra work, because we all have to kind of pitch in and make sure things get done. So I think we're you know, the past 2 weeks have shown how well we do operate, so.
And we need to grow at some point in the near future. Any other questions?
I have a question. I saw that you met with Joanne Faust on job descriptions. Can you fluff that out a little bit?
Yeah, so I wanted to talk to her about the Admin 1, Admin 2 job descriptions.
We have them, right, or we have to write them?
No, she writes all the job descriptions.
Okay.
Yeah. So I'm looking at that a little bit closely, and I think what I would like to do is move I don't know which one is which, but one is Admin 1, one is Admin 2. Move one of our admins in the future to it's more of a supervisory level, and more like an office manager in our office, rather than, you know, having having me meet with each admin.
right.
You have one person in charge and
Yep.
overseeing everything.
Okay, I still have a concern about the nurse's job description. I think it's terribly out of date. I think supervisory nurse or supervising nurses does not describe the position in any way. And I've talked to you before about it being updated, and I just wanted to go on record as suggesting again that it be looked at.
I think that a lot of the job descriptions in town are like that, and that's on the radar of the HR director. I don't know, if they have any plans to do any more updates or
But
not.
I think if they do it with the nurse, we need to include the nurse and/or you to get it, to give input as to what it really needs to be in the job description.
I think if they did it, they would probably do it, like the last time they looked at them, it was a town-wide type of
Okay.
job description.
And there was input from the people directly affected, or?
I don't know, the HR department.
It's a very difficult process to change.
I know it is, I know, I've been told that many times, but
I think that might go with not just the nurse, but with other positions in our department as well.
yeah.
Thank you,
Okay.
thank you. It's put it on our radar. If no other questions, I'll ask for a motion to approve the Director of Public Health.
Second,
I have a motion to approve. All in favor?
Aye.
Is there anything else? We've had a very intense meeting tonight. Lots going on. Is there anything else that anyone would like to bring up?
I
before we-
hope everyone had a nice Purim.
Thank you very much. And I know of a board member who starred in a local Purim musical. Motion, do I have a motion to adjourn?
so moved.
Second?
Second.
All in favor?
Aye.
Good night, everybody.
Be safe,
Be safe.
wash your hands.
Wash your hands.